Hi, everybody. I'm Dr. Nelson. I own Advocate Wellness right outside of Fort Worth, Texas. We are a health clinic connecting people with the fastest and most effective health solutions out there. You're watching my mini series on neuropathy and what you can do about it. Hey, welcome everybody. In today's video, we're going to be talking about how nerves work, both the structure, how they fire, and then the different causes of them to fire. And then lastly, a very, very important note on something called threshold. So please make sure and watch this all the way. In the previous video, we talked about the structure of the nerves, the three components of a nerve, the motor unit. So that's the conscious instructions to the body, the sensations, so that's the feeling we get back, and then the autonomic or the automatic processes of healing and regeneration that are happening all the time in the background that are subconscious. So those three parts. Today we're talking again about how nerves work, the two different types of things that cause depolarization, and a note on threshold. So watch it all the way through. All right, so first off, what is depolarization? Depolarization is a fancy term for when the nerve activates or fires. Those are all terms that we'll use for that. So what happens is that the nerve maintains itself at a slight negative charge. And when it depolarizes, it allows ions like sodium and potassium to flood back across the membrane of the nerve and to change the charge. And so it causes a change in the electricity of the nerve, which then causes a wave that travels down the nerve. All right, that's called depolarization. If it's coming up from the body, we would call it sensation. And if it's going down from the brain, we would call it motor signal. Why this is important to people with neuropathy. If the nerves are not in good health, not only will you have an issue with feeling the actual sensation, so you might have difficulty telling the difference between a hardwood floor or a carpet, you might also have additional sensations that are not actually caused by things in your surrounding. And that's because of the two different types of things that will cause a nerve signal. So let's talk about those. The two main types are chemical and mechanical. You can have a mechanical stimulus. So this is from sensing the things in your surrounding. So you step on a carpet and there's a slight pressure that triggers the types of nerve endings that are sensitive for light pressure. And that tells your brain, hey, we're feeling a lot of light pressure and around the outsides of our feet. We must be standing on something and your brain knows we must be standing on some carpet, all right? But if you have chemical stress, so this can happen from too much inflammation inside. This can be due to something like burns. This could be due to, excessive heat. It could also be due to too much sugar or some sort of poisoning. Nerves can cause a firing or a signal to go back up to the brain that is not accurate of your reality. If you're enjoying this video, please make sure and drop us a like. It helps us out tremendously and helps YouTube understand that it needs to show this video to more people who have questions or health concerns just like you. Thank you so much. That's the sensation side of things. So that's already a big problem because if you're not able to sense the world around you accurately, you can't respond to it. And that's where the second problem comes in. There's tremendous amounts of increased fall risk for people with neuropathy. You might have noticed that your balance has already started to decrease in its quality. You're not able to balance as well. You're not able to go around corners as confidently. You're not able to step out of bed in the morning and just step out of bed and get going because you have to get that moment to just kind of get your bearings. That's caused partially by improper sensation, but also by issues with your brain being able to give the correct instruction to the feet, to the muscles, because the nerve comes down from your brain, down your spinal cord, out the nerve root, goes down, and is supposed to connect to the muscle. But if that nerve ending is inflamed, then it's not going to send that signal correctly. Think of that nerve inflammation as static on a phone call. It's going to have trouble hearing you, and it's going to have trouble understanding you when you speak. So the body and the brain are having issues because of high levels of inflammation, whether from high blood sugar. Certain medications will cause inflammation in the body. Other issues can be going on as well as and up to chemo treatments are known to be very inflammatory for the body and cause issues with the nerves. So to recap, we've talked about how nerves work, what a depolarization is, how a signal goes along the nerve. We've talked about the two different types of things that can really affect the firing of the nerves, the mechanical and the chemical types, and how they're important to people with neuropathy. And then lastly, I want to touch on something called threshold. So the closer a nerve is to threshold, say your total, the line where something is going to fire, so the voltage where something's going to fire is up here. Well, the more stressed out you are, the more inflamed you are, the closer you're going to be to threshold. And the body uses this to increase sensitivity or decrease sensitivity. And overall, what a lot of people with neuropathy are experiencing is that things are very, very close to threshold. And so the slightest touch causes that nerve to fire. The slightest stimulation of the nerve causes things to fire. And so you might be feeling pain sensations, burning, shocking, numbness, tingling that don't belong. And that's why. One of the main goals of treatment here at Advocate Wellness is that we decrease how close those nerves are to threshold. We can do that by reducing inflammation, by reducing blood sugar levels, by helping your body heal itself so that you can walk around, you can live your life without getting extra pain signals that wouldn't be accurate to what's going on in your life. I hope you've enjoyed this video. My name is Dr. Nelson at Advocate Wellness. We connect people to the fastest, most effective health solutions out there. We'll see you in the next video. Bye.